So okay, we're going to have a look at the lumbar spine, and really the main first thing I'm going to do is look at it from the side, and I'm looking at Joe's quite a degree of kyphosis, probably a slightly heightened lumbar lordosis. Looking at it with him pretty straight, he's got some rotation, also his pelvis is going a little bit that way. So I'm coming around to the back, and I usually examine it from a kneeling position. I'm going to run my hand along, just to see if there's any step. Okay, or if there's a kink anywhere along his back, particularly step along here. Commonest area of spondylolisthesis, 4-5, 5S1. In fact, most things commonly in the back are 4-5, 5S1. Okay, so I'm now going to go through his range of movement. So I'm going to just find his PSIS, which is Joe is right beside Joe's dimple here. So I'm just going to ask him to bend back to me. So his extension is a bit limited. Come back up. Slide down the right, and I can see what's happening. He's got down to his knee, the other side, and I'm also looking, he's a bit tight on that side, I'm looking to see what's happening up here as well as down there. So he's done the two side flexions, so I'm going to ask him to flex forward.
Where the side flexion is?
Sorry.
Side flexion.
No, I do that at the end. And then, bend forward. And I'm watching to see what's happening as PSISs, and as you can see they're both rotating. Just do it again just so everyone can see that. When he comes, the PSISs are rotating. Okay, so we've done the 4 basic movements, so we're now going to ask Joe to bring his shoulder down to the side again, slide down the side of your body, and I'm just going to help him back a little bit. So that side flexion into extension, really screwing up the facet joint. So down the other side and come back to me. Pretty straight back, yeah, okay. So now we're going to do our neural stretch test. So we get Joe to sit, just balance a little bit off if you could, a little bit further off. Okay, I'm getting control here, either this way or that way and that way, I don't mind, as long as you control. I'm going to ask Joe to lift his leg up. Now, is that sore?
Yeah.
Bring your toe towards your face, is that sore?
Worse.
Worse. Okay, so I can ask him to take the flexion off. In Joe's case, I'm not going to ask him to do both legs together because he's already sore. Okay? So then I'm going to ask him to lie up on his back. I'm going to do a straight leg raise. Maybe changing size, but that's only just so you can see everything. So straight leg raise on this side is good. I'm just going to over pressurize that. Any pain now?
Calf.
So he's paining his calf. Bring your neck up towards your chin. Does that aggravate it?
Not a huge amount.
Okay. So I'm going to bring it down. So I'm going to test my myotomes now, which is, we're going to be able to bring his knee up towards his chest, resisted hip flexion, which is 2, 3, resisted dorsiflexion, bring your toe up towards, or your foot up towards your face, 4, big toe up towards your face, 5, foot out towards me, 5S1, resisted eversion, 5S1. Turn over for me onto your tummy. Ah. I do plantar flexion. Sorry. Yeah, but just do this one. I do his plantar reflex and his knee reflex on that side. So again, I'm staying on this side. I know the leg's gone over there. So I'm going to do 3, 4, which is resisted knee extension. Stabilizing him there. He's quite strong, so I have to move position. And I'm going to get here. Ask him to bring his knee up towards his bottom, 5S1. I'm just going to check, get your bottom to tighten. S1. Then I can palpate to find his facets. Basically, it's half my thumb out at the lower edge. So I'm just going to test him. Okay, and then I can test him with extensions just to find out the joint that's most likely to be giving him pain. But I'm changing the angle slightly because there is a curve. So up here it's that way, then it's that way, then it's almost straight down, then it's almost that way, and then it's almost that way. Okay?
Feels like